Today, I want to talk about congestive heart failure, not in a complicated medical language, but in plain English. I have my favorite throw with me today with hearts all over it in honor of today's video. After more than 2 decades of caring for people with serious and life-limiting illness, I found that many patients and families do not fully understand what heart failure means, what to expect, and most importantly, what they can do to live well. So let's start with, what is congestive heart failure? It is a life-limiting illness. A simple explanation of congestive heart failure is to think of the heart as a pump, and it's actually a muscle. Its job is to move blood throughout the body. With congestive heart failure, the heart becomes weaker or stiffer and just can't pump effectively as it should. Some common symptoms that you'll see in congestive heart failure are shortness of breath. This might show up as difficulty walking to the mailbox or climbing that flight of stairs that used to be easy. Fatigue, swelling in the feet and legs, causing shoes to become tighter. Weight gain from fluid retention, and you may notice along with clothes being snugger, rings don't fit. Difficulty lying flat, reduced ability to exercise, increased visits to the doctor, and sometimes the hospital. So as I said, congestive heart failure is a life-limiting illness. Let's talk about what that means. A life-limiting illness does not mean death is around the corner. It means the disease is progressive and cannot be cured. Congestive heart failure is a progressive disease that is not curable, but it can be managed for many years. There are several variables that predict life expectancy, but I have seen many people with a diagnosis of congestive heart failure, say in their 60s, live 20 or 25 years longer. The point is, patients with congestive heart failure can be managed with medical interventions and lifestyle changes that result in a long life. Heart failure often follows a pattern. Starts with a period of stability, followed by sudden worsening that results in a hospitalization and a return to partial recovery, but it results in a decline to a worsening health baseline. Over time, often years, the disease progresses into the advanced end stage. This usually shows up as repeated hospitalizations. Some symptoms of worsening progressive congestive heart failure may include extreme fatigue with simple activities and that just become exhausting. A loss of appetite, declining independence, needing help with bathing, dressing, or household tasks. But what can patients do right now? Well, here are 5 practical steps or suggestions. Step 1, weigh yourself daily. Weighing yourself every morning may be one of the most important things that you can do. Call your provider or your doctor or your provider if you gain 2 or 3 pounds overnight, 5 pounds or more in a week. Rapid weight gain often means fluid accumulation. Step 2, know what symptoms indicate worsening congestive heart failure. We have already reviewed those. However, keeping a symptom journal can be extremely useful for the patient, the family, and the medical team. Step 3, take medications consistently. Many heart failure medications aren't just treating symptoms. They help your heart work more efficiently and may help you live longer. Step 4, reduce excessive sodium in your diet. Salt acts like a sponge It causes your body to hold on to fluid. Examples of those foods can be canned soups, frozen dinners, fast food, of course, processed meats. You should be reading labels and looking at sodium content. And last but not least, number 5, have those hard conversations early with your family and loved ones about things like what matters to you most as it relates to your disease and your quality of life. What quality of life is acceptable? Who would you want to make decisions for you if you were unable to do so? And do you have an advance directive? If not, complete one. It becomes one of the greatest love letters you can give your family. In the description box, I will leave a link to a document called 5 Wishes. You can go online and get a copy for about $5. Fill it out. It covers a lot of territory and talks about your wishes. You do not need a lawyer. So when should palliative care be involved? Palliative care is appropriate long before hospice. Palliative care helps manage symptoms, resulting in improved quality of life. It is a holistic support for patients and their families while people continue receiving treatment. When might hospice be appropriate? Well, hospice might be considered when symptoms are worsening despite treatment and treatment interventions have been optimized. Hospitalizations become very frequent. There's a significant functional decline, majorly impacting independence and thus quality of life. And of course, when the goals shift towards comfort instead of curative or life-prolonging measures. Now, hospice is not giving up. Hospice is just shifting the focus towards comfort, dignity, and quality of life when curative or life-prolonging care is no longer available. One thing my patients with heart failure have taught me about life is that life is not measured by how strong the heart pumps. Life is measured by the moments of connection, of purpose, of love, and of meaning. The people who do best are often the ones who prepare, ask questions, follow the plan of care, and lifestyle modifications, and focus on what matters most in your life. Now, if you or someone you love is living with congestive heart failure, know that understanding the disease is empowering. Pay attention to symptoms. Take action early. Ask for support, and don't wait to have important conversations. You may not be able to control the disease, but you can absolutely influence the quality of the journey. Along with the 5 Wishes link, I've included a link to a free handout entitled Heart Failure Action Plan, 10 things patients and families should know. I hope that this was helpful. Please like, subscribe, and leave comments or questions. I'm Nancy Lee, NP. Thank you for watching. I will see you in the next one.